This year we've been hit pretty hard by the flu. Cases are high and it's not over yet.
And sometimes it's hard to know which virus you might have, so we want to show our audience a refresher video on the flu and some of its symptoms. Take a look.
ER rooms are increasingly busy across the country as flu cases rise.
Influenza does this, and this is kind of one of those things where it slowly goes up week after week, and then it really hits a peak, and it goes up exponentially for about 3-4 weeks, and then finally subsides.
The flu is a contagious respiratory illness that is caused by influenza viruses. There are two main types of human flu viruses, types A and B, and they're responsible for what we know as flu season each year. The symptoms can include fever, chills, aches, cough, sore throat, and runny or stuffy nose. A mild case of the flu can be treated at home, but it's important to get plenty of rest. Stay hydrated and take pain relievers for a fever. Your doctor could also prescribe antiviral medications. The best way to protect yourself and your family from getting the flu is to get the flu vaccine. It's especially important for those over 65, pregnant women, and people with pre-existing health conditions.
What I can tell you about the flu vaccines right now is that the flu vaccine and the flu virus that's in the community right now are pretty good matches. All right, based on the initial tests. And so this is probably a pretty good vaccine that will protect you from getting the flu, but more importantly, it protects you from getting really, really bad flu, like that gets you in the hospital or puts you on a breathing machine.
The good news here is that a lot of people are getting their flu shot.
That's right. I got mine, and as you say, so did a lot of other people. Overall, the percentage of children getting one dose of the flu vaccine was almost 58%. That's not a change from last season. For adults 18 years and older, it was 50%, but that was a decrease for all adults from last season. And fewer of those over 65 have gotten a flu shot this year.
Dr. Del Rio, there doesn't seem to be as much confusion over the yearly flu shot. Is that because a couple of types of virus are here on a seasonal outbreaks, or is there another reason?
You know, I think Mike, that we've gotten more used to the flu vaccine, right? If people are used to it, we've socialized it in an appropriate way. And, you know, I wish we could get more people vaccinated. We're still seeing a lot of people with flu. But the reality is that the flu has been much more socialized and is therefore more accepted. We see, I have patients who say, you know, I'm happy to take my flu shot, but don't give me that COVID vaccine. I think we have this sense of, you know, I understand the flu, but I don't quite understand COVID. At some point in time, hopefully we'll have both of those viruses in one vaccine, like we have many other vaccines that combine multiple viruses, and will make dealing with both viruses, or even, you know, we haven't talked about RSV. But if you combine it with RSV, maybe you can have a vaccine that covers all three viruses for people over the age of 65. Because again, in flu, I worry, and like in COVID, I worry about the impact of the disease in people over 65. People that I have in the hospital very, very sick with flu are people who are either not vaccinated or who are over 65 and not vaccinated.
Thank you, Doctor. And just to let our viewers know, we will be talking about the HPV vaccine and RSV as well in just a few minutes. But Dr. Patel, I want to stick with the flu here for a moment. Is it true that the vaccine is made with eggs and people who are allergic to eggs should avoid this vaccine?
It is true that the most flu vaccines are made using an egg-based manufacturing process, so it does have a small amount of an egg protein in there, but it is not true that if you have an egg allergy of any severity, that you should avoid the flu. So let me say it even more emphatically. Everyone 6 months and older, regardless of severity of egg allergy or no egg allergy, should get an annual flu shot, period. And this is because we've not only studied this and looked at people who have different types of egg allergies, including incredibly severe ones, and have not had any of the kind of problems you would think of, anaphylaxis or an allergic reaction. Having said that, that's why when we give people the flu vaccine, or any vaccine for that matter, we like to kind of go over things to look for. And again, doesn't matter what your allergies are, that's just common sense. But yes, go get that flu shot 6 months and above, regardless of egg allergy.